The Canadian Partnership for Tomorrow's Health, or CanPath, wants to thank all the participants who signed up with their regional cohorts to provide their health data since 2008. Your data is making a huge impact on research around the globe, and we want to share some of the amazing research that's been done thanks to all that data we collect. This is HEX. HEX is one of the 330,000 Canadians from diverse backgrounds and genders, ranging in age from 30 to 74, that has helped us by sharing information about their biology, behaviors, and exposures over their life. That information provides a lot of data, and it's rich data that has helped CanPath learn more about the causes of cancer and chronic disease. At recruitment, HEX filled out a questionnaire about health and lifestyle, provided measurements, and gave blood and saliva samples. Some of that data was used by a national study to explore the genetics of human hair color. For every red-headed person, there are 3 people with black hair, 5 with blonde, 15 with light brown, and 20 with dark brown. Researchers discovered that various genes related to pigmentation, like hair color, have been found to increase the risk of skin cancer. HEX's data was also used in studies exploring the links between physical activity and chronic illness. A study from Atlantic Canada discovered that exercise has a direct correlation and may help improve perceived health status of people with one or more chronic conditions. Meanwhile, another study in Ontario discovered that physical activity helps people sleep better and reduces sleep apnea. Over the years, HEX grew older, changed jobs, had a family, moved away, and all this time continued to fill out questionnaires and provide biological samples. Because of ongoing tracking, we could see how HEX's health changed over time. Now, researchers have access to years of data that helps with understanding longer-term health impacts. A national study using CanPath data investigated the relationships between risk factors and early-onset breast cancer. Researchers found that measures of fatty tissue in the body, history of pregnancy, and family history of breast cancer are important risk factors for early-onset breast cancer. An Alberta study researched the impact of men's sleep in relation to prostate cancer. Researchers found that when men experience lack of sleep during workdays and compensate with more sleep on their days off, they are at an increased risk for prostate cancer. At 50, HEX developed cancer, and the data given during this time helped researchers learn more about the links between environmental and lifestyle factors and cancer. For instance, because HEX provided blood samples over the years, researchers used blood samples prior to diagnosis and applied machine learning tools to identify specific patterns that are indicative of cancer. The research provided evidence that cancers could be detected and/or diagnosed even earlier. Once again, thanks to HEX's ongoing health reporting and samples, when the COVID-19 pandemic struck, CanPath scientists could respond quickly, with research that was instrumental in informing the second vaccine dose strategy applied across Canada. Over 250 research projects using CanPath data and biosamples are already underway, and over 200 scientific studies have been published. Thanks to our participants and our founding funder, the Canadian Partnership Against Cancer. And you too, HEX. CanPath has been aiding researchers in solving some of our biggest health challenges since 2008. Together, we can work towards a world without chronic disease and cancer. Learn more at canpath.ca.